This is Dr. Mazhar, and today we would discuss about the naproxen fever test. What is naproxen fever test? So, a naproxen fever test is a diagnostic test used in pyrexia of unknown origin, especially those with cancer, known case of cancer patient, to differentiate between fever caused by either neoplasm or an infection. So, it simply the naproxen fever test is used to differentiate between neoplastic and non-neoplastic fever. So, naproxen fever test is diagnostic test used to differentiate between neoplastic fever and non-neoplastic fever. Let's suppose you have a patient in your ward, in your medical ward, that is a known case of carcinoma and now presented with pyrexia of unknown origin, and you want to let know whether that the fever is of neoplastic in origin or non-neoplastic in origin, whether the fever is of because of the neoplasm itself, malignancy itself, or an infection. So this is a very simple test that could be done. So how it works? The naproxen is basically an NSAID that how does it works? The mechanism of action is it blocks prostaglandins production. Prostaglandins are involved in the initiation of inflammation and fever. So how is the test done? 250 mg of naproxen tablets are given orally TDS 8 hourly or TDS 3 times a day for 3 days a day, and the fever is monitored. What happens if it is positive? Positive means a rapid and sustained drop in fever suggests that the fever is likely due to underlying malignancy. If little to no change in fever suggests that the cause is likely an infection which require further investigation and different treatment. So this is a simple case of naproxen fever test, how you do it and why to do this. So it's all about the naproxen fever test. It is done to differentiate between neoplastic and non-neoplastic fever, how it works, and it is an NSAID that blocks prostaglandins production. What does the positive test means? What does the negative test mean? The positive test means that fever drops, so that fever was most probably due to malignancy. If the fever persists, that is because of an infection. And how it is done? 250 mg of naproxen orally given 3 times a day for 3 days, and the fever is monitored. So if it is positive, you should be going in that direction. If it is negative, then further investigation and evaluation and antibiotics are